There are many human struggles and medical issues related to a life-threatening illness. The emotional and spiritual needs of a patient with a short prognosis are often overwhelming. Hospice provides services that offer comfort and reduce the suffering of any patient battling disease or condition that can no longer be treated. But as many providers can attest to, not all hospices are created equal, which is why it's essential to do your research before hospice care is needed.
When a patient is diagnosed with a terminal illness, their first thoughts of what will my end of life look like? And so it's important that that patient and family sit down together. They discuss what that patient wants to have at end of life. So the first thing we make sure that when a patient comes to us, what are the patient's goals? What are the family's goals? Are they in alignment? Because that's the most important piece of this.
Established in 1980 and located in Carlsbad, California, Hospice of the North Coast is dedicated to meeting the physical, psychological, and spiritual needs of terminally ill patients and their families, providing an array of programs and services to the terminally ill, their families, and the community. Its caring professionals are committed to bringing comfort to their patients.
We have an entire team that is made up of social workers, nurses, we have bereavement counselors. All of those people come together to make sure they bring the quality and the service that that patient and family is seeking. We have volunteers that will bring pet therapy. We have volunteers that bring music therapy. Many people will have a dual diagnosis of a terminal illness and maybe some dementia. So as we bring these other therapies in, it helps them to relate better to memories past. It's so important that we don't just see a patient in a bed and that's who they are. That patient had a whole life and all the things that were important to them. We want to make sure as they move towards that end of life that we're bringing all those things with them.
In the decades since the inception of hospice in America, the incidence of chronic disease have increased dramatically. Unlike hospice care, palliative care is appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment. It's specialized medical care for people living with a serious illness, with the goal of improving the quality of life for both the patient and family.
Palliative care is comfort-focused care throughout a disease process, typically starts at the onset of diagnosis throughout, and it really includes the patient to continue aggressive treatment to try to manage that disease as long as possible. Hospice of the North Coast Palliative Program is a true community-based palliative program that includes a physician that oversees all of the cases, as well as nurses, social services that help manage the patient's symptoms with medication, as well as any resources, keeping appointments, keeping compliance, ultimately to keep that patient out of the hospital and continuing with a quality base at home.
The cultural changes brought on in part by hospice have encouraged Americans to face end-of-life issues more openly. Because grief often takes place before the death of a loved one, it should be addressed early on and continued after the passing.
Pre-bereavement, simply defined, is working with patients and/or families while the patient's still alive. The benefits are, for the patient, they have someone to talk to about their experience. Much of the time, they don't feel comfortable talking to family members. On the family side, a lot of family members are caregivers, and they're suffering from fatigue for caregiving of their loved one. And the pre-bereavement gives them a place to talk it through, actually start to strategize maybe better ways to take care of themselves and the patient. And last, just simply a family member just going through the process is allowed to explore their feelings of how they're feeling about their loved one dying and this pending death.
I was diagnosed with stage 4 pancreatic cancer 2 years ago. I was on chemo for a year and a half. And the turning point was when I was hospitalized for sepsis. And I decided at that point I don't want any more curative treatment, and immediately my thoughts went to hospice. I ended up choosing Hospice of the North Coast mainly because of where we're sitting right now, Pacifica House, because this is the only inpatient unit of any hospice in North County. Since I've been on Hospice of the North Coast, What's been of great benefit is having the staff be just so compassionate, just so kind.
When your physician says to you, it's time to look for a hospice, don't hesitate. Begin to look for the hospice you want and why you want that hospice. It's important that you have longer on hospice than just a few days. Hospice can improve the quality of the end of your life versus the quantity, and that's the important piece we want you to know.
When time is short and medical science has no more to offer, hospice is a family affair that offers the promise of comfort. Learn more today about Hospice of the North Coast. Your life, your choice, your way. To learn more about our services or to donate, visit hospicenorthcoast.org or call 760-431-4100.